Hi, welcome back to my channel. Today we're gonna explain more about cyanotic congenital heart disease. The second part, we're gonna learn about the transposition of the great vessel. First thing, who are the great vessel? It's the vessel who gets out from the heart. Two arteries, the aorta and the pulmonary artery. So, just without knowing anything from this lecture, if someone asks you the transposition of the great vessel, you should think first, what are the great vessels? It's the vessel who get out from the heart, and we have two arteries, aorta and pulmonary. So you will know that there is something wrong with the aorta and pulmonary artery. What is transposition? Transposition is switch place. So if someone asks you, what is transposition of the great vessel? You should know there is switch place between the aorta and the pulmonary. There is something I forget to say it in the previous video. The tetralogy of Fallot is the most common cyanotic congenital heart disease after the neonatal period. It means after the first 28 days of birth. So, if someone asks you what is the most common cyanotic congenital heart disease after the neonatal period, it's the tetralogy of Fallot. But if someone asks you what is the most common cyanotic lesion during the neonatal period, is a transposition of the great vessel. Neonatal period, it's the first period 28 days. This is the neonatal period. So the transposition of the great vessel, it's during the first 28 days. We have abnormal rotation of the great vessel. So the aorta became in the place of pulmonary, and the pulmonary is a switch with aorta. Abnormal rotation of the great vessel during cardiac development result in aorta arising from the right ventricle, and the pulmonary artery arises from the left ventricle. We have arterial switch. So let's explain it as this is the right ventricle, and we say the aorta will get rise from it. So here's the aorta. Okay, and this is the left ventricle, and we have the pulmonary artery arise from it. Let's go with the aorta first. Here are the blood moving and coming back. We noticed if we take a blood sample from it, we will notice that there will be always deoxygenated blood. And we know that the aorta is pumping blood to the body. So if we take any sample from the body, it will always be deoxygenated blood, and it will never become oxygenated. Why? Because it will never go to the lung. So in the body, or where the aorta pump blood, it will always be deoxygenated and will to the pulmonary. Here's the blood come, get out, and return. The blood going to the lungs. So it will always be oxygenated blood. So the blood that carried by pulmonary artery, it will always be oxygenated. But the blood that carried by aorta, it will always be deoxygenated blood. So how this baby will live? How this baby will live? We need oxygen to the body to live, right? So how this baby will live? it will live if they're mixing between the two blood vessels. How will be a mixing? Okay, let's think and make it more sense. First thing, VSD, ventricular septal defect, and it's found in third of the patients. And it makes sense because there's is opening here between the right ventricular and the left ventricular, there will be mixing between the deoxygenated blood and oxygenated blood. The second one is atrial septal defect between the atrium septal defect. Also, if we have ductus arteriosus. And in ductus arteriosus, here is like the most important because we give patients Prostaglandin E just keeping it open, so we can use it as a treatment for keeping the mixing between the deoxygenated blood and oxygenated blood. We should know that Allah created us, that the right ventricular is for low pressure and the left ventricular is for high pressure. But when the aorta become in the right side or pumping from the right ventricular, the right ventricle that is designed for low pressure will become hypertrophy. And the left ventricle that is designed for high pressure, because there is a pulmonary artery that will make him atrophy because the aorta is not here anymore. So the left ventricle will become atrophy and the right ventricular will become hypertrophy. So when these structural changes happen in the heart, will become a heart failure. What does presentation? The presentation will be cyanosis, of course. Also, in auscultation, you will hear a single S2. When we do chest X-ray, we will see egg on string, like this, as shown in the picture. Here, egg on string. So how we diagnose it in echocardiogram and also in chest X-ray? What we say we will see? Egg on string. What is the treatment? The treatment, we say the open ductus arteriosus must keep. How do we keep it? By giving Prostaglandin E1 to keep the ductus open. And we should avoid giving him NSAID or conjugated because they will close the ductus. We also could do two separate surgery, but the surgery carries 50% mortality rate. And that's it, the transposition of great vessel.